Howdy! My group will be presenting on increasing sexual health knowledge on college campuses. My name is Sophia, and my group members' names are Anoushka, Kellijett, and Sydney. Think about the sexual health knowledge you've received in your past and how well equipped you might feel. You might be surprised by how much information you might be missing. According to the CDC, teens and young adults have the highest rates of sexually transmitted diseases among other groups. It is important for college students to be aware of sexual health and be well informed on sexual health knowledge because they are an increasingly vulnerable population. College fosters new opportunities for students to explore their freedom and their identity. One way that they might explore their freedom is by enrolling in a study abroad program. Study abroad poses a new outlook as recent studies show that during study abroad experiences, college students greatly increase their drinking behavior, which in turn increases their risky sexual behaviors. Our thesis is that sexual health knowledge is critical for college students to lead a healthy and safe life. First, we will talk about the lack of sexual health knowledge and specifically why it is important to have a comprehensive sexual health knowledge education versus other programs such as an abstinence-only program. Then we will describe certain university policies that we have suggested could be beneficial, such as on-campus services and possibly mandatory classes. And lastly, we will discuss the best ways to promote these new practices across our campus.
Sexual health knowledge is critical information for college students to have. There are two common types of sexual education programs in the United States. First, there's the abstinence only. Second, there's the comprehensive-based sexual education. Abstinence-only based programs encourage people to abstain from premarital sex by encouraging them to avoid sexual activity. Comprehensive sexual education programs include encouraging abstinence and incorporating information on STI prevention, correct contraceptive use, and violence awareness. Texas is an abstinence-first sexual education state, and it does not require having a comprehensive education. According to a research article, comprehensive sexual education programs are most beneficial in promoting sexual decision-making by delaying the onset of sexual activity, increasing the contraceptive use, and diminishing the likelihood of STI and HIV contraction. College students lack sexual health knowledge. According to several surveys and research, college students are frequently unsure of how STIs are transmitted or diagnosed. This lack of knowledge can make it difficult for college students to protect themselves or to discourage them from engaging in risky sexual behavior. According to the CDC, the largest numbers of new HIV infections are accounted for among persons aged 15 to 29. The research goes on to say, young adults aged 15 to 24 have the highest rates of sexually transmitted infections of all age groups. This may be caused by the lack or inconsistent use of protection and the lack of education about the STIs and the prevention of STIs. There are specific sexual health topics that should be covered in a class or discussion to help college students live healthy lives. According to several research articles, the essential sexual health knowledge topics include, but are not limited to, basic anatomy, types of STDs, STI and HIV transmission, ways to reduce exposure to health risks such as those STIs and unplanned pregnancy, proper protection, and sexual decision-making and communication. It is critical for college students to have access to sexual health knowledge. According to a study, findings showed that when college students needed information on sexual health, 18 to 28-year-olds did not know how to find the appropriate resources to answer their questions. Without access to this information, it is less likely students will enjoy healthy sexual relationships and will make safe choices. They may also suffer negative academic outcomes that have long-lasting repercussions. As students enter the college campus environment, many new opportunities and responsibilities open up. To help ease this transition, the universities provide many resources to support the students. It is important that the university extends this support to educating its students about their sexual health.
Now that we've established that the problem does in fact exist and must be addressed, let's explore the measures universities can take to bridge the students' knowledge gap of sexual health. There are several ways the university can provide affordable and accessible sexual health resources on campus. One proposed solution is to establish a mandatory sexual health introductory class for incoming college students, specifically freshmen. According to a study in the Journal of School Health, structured sexual education programs in college significantly improve students' knowledge and attitudes towards sexual health. Kohler et al. 2006. These classes could cover a wide range of topics in order to cover the full breadth of knowledge that sexual health falls under. By including various topics like basic sexual health, contraception, STI prevention, and managing healthy relationships, students would be able to get answers on many of the problems they may face throughout their college career. By ensuring that these classes are taken by all freshman students, including transfers, universities would be able to provide a foundational understanding to them. This would encourage responsible behavior early on and ideally help mitigate future issues related to sexual health. Another way that universities could provide sexual health resources on campus would be through on-campus sexual health services. These would ideally be offered to all students on campus for free or at a subsidized price, organized by the university. A report by the American College Health Association highlighted how on-campus health services have been shown to promote sexual health and reduced risky behaviors in students. This was a study conducted across multiple schools, and this found results that were incredibly supportive to the point. ACHA 2022. Health center clinics would be one option related to on-campus services. And there are also many other options that are included. Some choices that could be offered to students would be complimentary STI testing, free access to contraceptives, and having women's health services available as well. By providing resources like this to students in an accessible manner, universities would be able to reduce the likelihood that students engage in risky behaviors. Offering workshops and seminars relating to the topic would also bolster the knowledge of students on sexual health. Having regularly scheduled educational sessions covering a wide range of topics on the subject would greatly benefit students as well. Now, some may say that implementing these measures is difficult due to the financial constraints that many universities have. However, there are ways to make these solutions cost-effective for both students and the universities themselves. For example, students can utilize federal or state grants to fund these programs. Many such funding opportunities exist that aim to improve public health education. Thus, it is extremely important for universities to take advantage of these resources. In addition to this, universities can collaborate with local health organizations. A study in health promotion practice found that partnerships between universities and local health organizations can reduce costs and improve access to sexual health for students. Goodson et al. 52. Providing these sexual health resources at a reduced cost can help bridge the gap between lower income students and access to healthcare. This would ultimately benefit the entire community and help all of us as a whole.
While university support is incredibly important and vital when providing students the tools that they need, there are many things that students can do in conjunction with their university to promote safe sexual behaviors and practices. Sexual health is incredibly stigmatized, and after learning more about how to make informed decisions and keep themselves safe sexually, many students may have questions and not know where to ask them or not want to ask them at all. Many students may feel embarrassed or judged by a campus health professional or even a doctor outside of the campus setting, especially when those conversations involve sexual practices and possible STIs. According to a study done by Aber and their colleagues in 2014 on higher institutions, there are high rates of STIs in students who lack the knowledge on contraception and how it is used. And it's very interesting to know how many of those students just simply didn't ask about it because they were embarrassed or nervous. Breaking the stigma is incredibly important, and it can bring much confidence to students and bring much more engagement in university programs, which then leads to universities being able to get more information out to their students. While universities can provide seminars and surveys and emails, students may not engage with them despite university efforts because of how uncomfortable they may be with the topic of sexual health. Having student-led interventions and student-led health promotions through banners, posters, pop-ups on campus, or even online promotions can make an incredible difference in how students engage and how comfortable they are in learning and being able to gain the information they need to make those safe sexual decisions. In a study done by Valentine and their colleagues in 2022 on sexual health in specifically rural areas, STIs are so stigmatized that sexual health care has become so scarce that it is now one of the largest health disparities. Providing casual and open opportunities for students to talk to their own peers that can guide them to who they can talk to, where they can go to get more information, can lead to students feeling less judged and more open to learning about safe sex, and they will know that they have the support from both their university as well as the student body, and they can fully engage in the university programs and the university's efforts to provide them with the information that they want them to have in order to secure their futures and maintain their sexual health.
In conclusion, advocating for a comprehensive sexual health education, especially in the state of Texas, is incredibly important to improve the overall sexual health knowledge of college-age students. Some options for improving the overall sexual health knowledge is implementing new on-campus services and possibly a mandatory sexual health class that would be an intro sexual health class for incoming freshmen. To make these new policies possible, university-wide support is key. It is important for both the faculty and the students to be in support of this new movement, not only to spread awareness of sexual health knowledge and its importance, especially for the college community, but to also help reduce the stigma that is currently around speaking about sexual health and all of the risks that might come with it. Ultimately, sexual health knowledge is critical for college students to lead a healthy and safe life, and it is imperative for them to receive this comprehensive sexual health knowledge, not only for their own safety, but also for the safety of those around them, ultimately hoping to reduce that stigma in the future and make it something that we can all talk about.